Hi, I'm Jim Hugh, Director of the LaFrac Center for Robotic Surgery and Professor of Urology at Weill Cornell Medicine. I'm delighted to go over with you some common questions related to radical prostatectomy as a treatment option for prostate cancer. So what is a radical prostatectomy? A radical prostatectomy is complete surgical removal of the prostate and the seminal vesicles for the cure of cancer. The seminal vesicles are small bags, if you will, that extend off the prostate on both sides. Their function is to store part of the ejaculate, and the role of the prostate is to contribute the majority of the ejaculate. The prostate does not produce androgens or testosterone, therefore there's no hormonal side effects after removing the prostate. In terms of different approaches to radical prostatectomy, currently about 90% of all radical prostatectomies in the United States are performed with robotic assistance through a minimally invasive approach. Traditionally, even 15-20 years ago, the majority of all radical prostatectomies was done through an open retropubic radical prostatectomy approach. That means that there was an incision from the belly button to the pubic bone through which retractors would spread the tissue, and the surgeon would then use instruments that were held by the hand to perform the operation. The benefit of the robotic-assisted minimally invasive approach is that because we're inflating carbon dioxide to create space, that carbon dioxide pressure also decreases bleeding. Typically, the blood loss from open surgery was about 1 liter of blood loss, and with the robotic-assisted approach, it may be only 100 to 200 cc's, and therefore this is 10 to 20% the blood loss of the open approach, and the risk for needing a blood transfusion is much less. In addition, the discharge from the hospital is typically within 24 hours after robotic-assisted surgery. This was typically a 2-day or longer length of stay with the open operation. In terms of the published benefits of robotic-assisted surgery, beyond the lower blood loss, the shorter hospitalization, as well as the lower transfusion rate, it's also been demonstrated the likelihood of scar tissue formation, or what's called a stricture, that may restrict the flow of urine, is much lower with the robotic-assisted versus the open approach, and this may likely be due to the better magnification that one can see during the robotic-assisted surgery when you reconnect the bladder to the urethra. When is a prostatectomy recommended for men with prostate cancer? Increasingly in the United States as well as developed countries, men who are diagnosed with the lowest grade of prostate cancer, that is a Gleason 6 or grade group 1 prostate cancer, opt for active surveillance. Active surveillance is measuring the PSA every 6 months, repeating a biopsy MRI after a year, and if it stays a Gleason 6, then that man may remain on just monitoring with a curative intent of intervening with surgery, radiation, or focal therapy if the grade of the cancer increases from a Gleason 6 grade group 1 to a Gleason 7 grade group 2 or higher. And therefore, the decision to do radical prostatectomy or radiation is an individualized one. Although the majority of men with low-risk prostate cancer opt for active surveillance, there are men, particularly younger men, who feel that they don't want the anxiety of being on active surveillance for the rest of their lives. For instance, when we look at longitudinal series, approximately 40 to 50% of men within 5 years, they have findings on pathology that may increase and therefore take them off of active surveillance. And so therefore some of these men who may be averse to the discomfort of prostate biopsies, the anxiety of getting repeat PSA testing, or the risk of having a serious infection associated with the biopsies of active surveillance may opt for surgery despite the fact that they have low-risk disease. There are also more genomic markers now to help a man better predict if he has more aggressive disease despite the appearance of the cancer under the microscope or the grade.